get started then. I'm going to share my screen in a moment, but we're here today because we're releasing our new report, which is a report on the COVID-19 crisis in Ontario's long-term care homes in the second wave. And I just want to start by saying we really thought through the language carefully. You know, it's a pandemic and there's no reason to create problems. In a pandemic, there are enough problems already. And as a coalition, our job, our goal, our mandate is to improve healthcare, you know, in the public interest. And so after troubling for a long time about how to word things, you know, we came to a title for the report, which is it's a call to conscience, the COVID-19 crisis in Ontario's long-term care homes. And it's a call to conscience because what is happening in the homes violates the basic morals of our society, we believe. And it still is not addressed, and it needs to be addressed. And the crisis every day is deepening and is intensifying. And we chose the word crisis carefully, but it really is a crisis. And so I'm just going to start sharing my screen because I want to show you really the numbers speak for themselves. Okay. I'm just trying to figure out how to run my slideshow here. All of the menus cover up the other menus. Okay, well, can you see this screen?
Yes.
Sorry. Okay, that's better. So this is the very current news. In the last 24 hours alone, 18 residents have died, and there have been 115 new reported COVID infections in Ontario's long-term care homes. That's in 24 hours. As of December 15th, so the most recent data available, 4,594 residents and staff have been infected in the second wave. And the death toll, including last night's death toll, brings us up to more than 700 people who have died in the second wave. To put this in context, on August the 31st, there was one resident and 22 staff with currently active infections. On December 15th, there were 1,456 currently active staff and residents with currently active infections, I should say. We've been watching over the last few days as the numbers just explode in home after home after home all across the province. I've given you a few here. You can see at Berkshire Care Centre, December 12th was the outbreak. By December 16th, 4 days later, 35 cases. Westside Long-Term Care Toronto, November 12th was the outbreak, less than 5 cases. By a month later, December 16th, 253 cases and 25 deaths. Grace Villa, Long-Term Care Hamilton, November 25th was the outbreak. December 14th, so just around 2 weeks later, 173 cases and more than 15 people had died. Village at St. Clair, Windsor, the outbreak was just found on Saturday. As of today, actually, there are more than 100 cases and 3 died overnight last night. Shalom Village Nursing Home, Hamilton, December 9th was the outbreak. December 13th, 47 cases. Tyndall Care Center, November 5th was the outbreak. At this point, we have 200 cases and 29 deaths. This is what we're looking at. And so when we say it's a crisis, when we say that the measures that have been taken to date are not working and they are not effective in stopping the spread of COVID-19 or saving people's lives in long-term care homes, we're not exaggerating. This is what the curve looks like at this point. The first lines, the blue and the green lines, are the first wave. The blue line is the data from Public Health Ontario, which we know was problematic in the first wave. The green line is the data that we collected through the first wave. The red line is wave 2. And you can see that far from protecting residents from a second wave of COVID-19. We're now a good way up towards the very height of the first wave in Ontario. With that, I'm going to turn it over to Dr. Amit Arya, who's a board member of the Ontario Health Coalition and a palliative care physician and a specialist in long-term, works in long-term care homes as well as in hospital. Dr. Arya is going to cover some of the key issues that we found in this report. The report overall looks at the performance of the province to date in its measures to protect residents and staff in long-term care from COVID-19. Amit.
Yeah, thanks, Natalie, and thanks everyone for joining us this morning. I mean, just to kind of add a little bit of more information to what Natalie has just offered. I mean, we've now seen a big expansion of these outbreaks in long-term care facilities. It really started off in Ottawa, at the end of August, and then within a couple of weeks, there were actually 11 homes in Ottawa that were affected. Eventually, it was in all the hotspot regions such as Peel, Toronto, and Ottawa. Then it moved to surrounding regions, and now it's really border to border, starting from southern Ontario all the way up to northern Ontario. And Natalie has shown the numbers. From October 27th, we've really seen that cases and deaths are, accelerating in a very alarming way. And really, we have to ask ourselves, how is it that, with months to prepare, with the first wave and, the disaster of the first wave already is something that we all know about. We had the military in our homes, and our government and, these long-term care homes had months to prepare for the second wave, and yet we're seeing this horrific, deja vu now in these homes, which with so much suffering, and death as well. So, I mean, one part of the failure that I'm going to go over to is around infection control. And once again, it's very appalling that even at this stage, we don't have accountability around infection control. We don't have government oversight in each of the homes about what is going on a day-to-day basis, how they're cohorting patients, how they're testing, how they're donning and doffing PPE. I mean, and that's actually something that's a big failure, even on the homes end, where we're seeing either a competence, either some type of combination of gross negligence, also combined with, incompetence. And that's actually a big problem, because these homes are actually supposed to provide proper infection control. They're supposed to have emergency plans in place under the Long-Term Care Homes Act. And over the last few weeks, we've heard that, over a dozen homes or more, there's staff that is saying that they're short of gowns and gloves, disinfectant wipes, and they don't have proper, supplies. They don't have N95 masks. And once again, it's not even about the supply. It's about knowing where those, essential things are in the home if you're a frontline health worker, and also knowing how to use them properly and having that support and oversight as well. So that's obviously a big problem, and we can obviously see how that's contributed directly to the miserable suffering and death that we're seeing now. And all of this, of course, comes down to staffing, right? When it comes to providing any type of care in the home and doing anything properly, whether it's infection control, basic care needs such as making sure people are fed on time and hydrated, making sure people aren't waiting to go to the bathroom, making sure that we get people up and out of their bed and put them into a wheelchair, making sure that we provide them human contact and emotional support, which are all non-negotiables for seniors and other vulnerable people living in long-term care. I mean, that can't happen when you don't have enough trained staff on site. And sort of a reminder for everyone on this call, the Ontario Health Coalition did a report based on a survey in the summer where it was found that 95% of frontline health workers in long-term care were reporting staffing shortages. About half of them, or a little over half of those health workers, were actually reporting staffing shortages every day, which was leading to ongoing neglect and abandonment of the residents. And that's just, of course, heartbreaking. It's unacceptable. And we have to ask ourselves, why has this not been treated as an absolute emergency? And why hasn't our government stepped up to provide an appropriate response? What we're hearing from these homes, and another point that I wanted to bring up, is that when an outbreak happens with COVID-19, and especially a disease like COVID-19, and I've been on the front lines working in these homes with COVID-19 outbreaks, I mean, it's a disease which can, cause residents' health to decline very quickly. People can become short of breath, their oxygen levels can drop, they might stop eating or drinking, and they could become delirious. So actually, we needed a response that facilitated more care for the residents because they're sicker. You can't have less care when acuity of the residents is actually higher. But yet what we see happening in these homes is that the staffing level actually plummets when there's a COVID-19 outbreak. And what really should have happened is we should have had a reserve force of staff ready to step in at the first sign of any trouble with a low threshold for intervention. So the fact that we have thousands of long-term care residents at this point, in the province who have died alone, who have received inappropriate care or not enough care actually, and people who have suffered and died because of really abandonment, and people who have died from dehydration or hunger is absolutely atrocious, and it's a human rights violation. We also have to recognize, one thing that the province has to do immediately is make sure that we solve the staffing crisis today. They need to act on this today and use all their resources and all their power to get enough trained staff on site. And that starts with legislating a minimum staffing standard, which people have been calling for decades, with a funding and timeline, and also improving the working conditions so health workers aren't leaving the profession in droves. So that means making people full-time, closing the dangerous loophole that allows agency workers to move between homes, which is still happening at this point during the pandemic, giving people sick leave and benefits, and also paying them a decent living wage. These health workers, we're now asking them to get vaccinated and so on, but we haven't actually treated them with proper dignity and respect when they've actually been working some of the most dangerous jobs during the pandemic, and they're being they're left feeling angry and vulnerable and even sacrifice themselves. So it's completely inappropriate. And if we think about this tragedy and we say never again, action needs to start today.
Okay, thank you very much, Amit, for that. So I'm just going to cover the major things that we found in the report. The bottom line is that there has been a total failure of leadership in Ontario. There's been a failure to plan for the second wave. The conditions that we're finding in the second wave are just like the conditions that the military exposed to Ontarians' horror in the first wave. And that even in the cases where homes have asked for support, they have not been able to get it because the resources are no longer available. I think I have to start by saying that things are much worse now in a number of ways than they were in the first wave, particularly with staffing. We lost so many staff in the first wave, and as the second wave has gained amplitude, what we see is that staffing is crumbling, and I chose that word very specifically. It's crumbling in home after home after home as the outbreaks progress. The homes lost staff. They didn't have enough at the beginning of the pandemic. They lost staff in the first wave. In the second wave, as staff get sick, as more leave, there just simply is not enough staff to provide basic care. We look at 4 different case studies in the report in depth. And in these case studies, we find families telling of their loved ones left in excrement, with feces on the wall, of homes in chaos, of residents wandering into and out of COVID hot zones because there are no staff left to cohort them to make sure that they're safe, of homes in which they've put up physical barriers to try and stop residents from wandering around because there are not enough staff to sequester them anymore and keep them safe, of care levels that have fallen to the point that people are again starving and going without basic hydration. Again, I'm choosing my words very specifically. We're not trying to create problems here. We are bearing witness and we're describing the situation that is happening. If you could imagine living in one of these homes, Extendicare West End Villa, where the second wave started, for example, a home that had about 213 residents at the beginning of the second wave, having lost some residents in the first wave as people were taken home and so on. By the end of November, beginning of December, there had been 88 residents of the 213 infected by COVID-19. Imagine living in that home as COVID-19 is marching down the hallways, room to room to room. Residents' families talk about residents being left beside roommates that had COVID-19 not being sequestered or cohorted. Residents' families talk about a decline in care that is egregious, that is completely unacceptable. Interventions were not made until scores of residents were infected. The Minister of Long-Term Care and her spokespeople and the local public health unit spokespeople said that They were in touch with the home daily, and the home was reporting there was enough PPE and enough staff. And yet the accounts, the on the ground accounts of families and staff are completely to the contrary. Staff report that they didn't have access to N95 masks. At the beginning of November, the spokesperson for Extendicare, the owner of the home, actually said that N95 masks are not recommended in long-term care, but if the staff ask for them, we'll provide them. What kind of standard of infection control 9 months into this pandemic is that? It's outrageous what's happening. That's Extendicare West End Villa. We look at Kennedy Lodge in Toronto. Kennedy Lodge, by mid-November, 92 residents were infected, 30 had died, 35 staff were infected. So, 130 approximately staff and residents infected. Staff report that half of the staff was not into work and they weren't replaced. They report problems accessing PPE. They report major problems with cohorting and protecting the residents from getting infected from other residents. Extendicare Starwood, this home actually had better communications with its residents and with its families at the beginning, but as the huge outbreak there went on, by mid-November, they had 134 residents, including 23 deaths and 46 staff infected. So almost 200 by mid-November in that home. Residents tell of their families tell of their family members being left for days next to COVID positive residents as COVID was spreading through the homes. We hear that the staffing became very, very critical. Major problems in providing the cohorting, the protection, and so on, as the staffing levels began to crumble through that outbreak. This is a publicly owned home here, Prescott and Russell residents in Hawkesbury. And in this home, the owners are, which is the county, they're a lot more open about what happened in the home. Where from the beginning of over the 10 weeks of the outbreak to date, to the end of November, 109 residents, 67 staff infected, 14 had died at that point. And care just fell apart. They didn't have enough staff. They didn't have enough staff to start. As the outbreak continued, they lost more and more staff. The residents talk about not getting basic care. The administrator tells that they didn't have enough staff to dress the residents, to get the residents up and dress them. And so they put them in hospital gowns so they weren't lying naked on their beds. He talks about having asked for help. They asked the hospital for help, but the hospital was over capacity. They had no one to send in to help. In the end, the county sent in paramedics to help in that home, but not before the virus had just ripped through the home. And made so many sick and so many die in that home. We look at the measures that the government has taken to address COVID-19 through the first wave and into the second wave, and there have been some improvements. In particular, there's improved access to PPE, but as we describe, it's not enforced. The staff under the directive are required to ask for access to N95 masks. The homes can't deny them, but in many cases, the staff tell us they don't know where they are. They have to sign them out, and the homes are dissuading them in many ways from doing it and just not providing them with access. And it's not just N95 masks. It's gloves and gowns and all kinds of PPE. In some homes, they describe not even having disinfectant wipes to clean. In one home, they're using hand gel and paper towels to clean surfaces because they have no disinfectant wipes. While there have been some improvements in PPE, it is far from complete. The homes have been forbidden to continue with 4-bed shared rooms. This is a significant improvement. However, it's being undertaken by attrition. So as people die or leave, or as they cohort residents out of those rooms, they can't admit more than two to a room. So many homes still have 4 to a room, but that is an improvement. Most of the improvements where they've been made are partial or have gaping loopholes that are purposely written in at the behest of the homes. So for example, the requirement that staff work in one home staff that have multiple part-time jobs, as of April 22nd, were required to work in one home. But in the directive and the guidance and all the policy documents around that, agency staff, that is temp staff, are expressly excluded from that. And so agency staff are allowed to work in multiple homes. And as staffing levels have crumbled in the homes, and homes were not required to provide full-time jobs for their staff, for the remaining staff. And so as staffing levels have crumbled, homes are relying more on agency staff than ever. And those agency staff are traveling often from home to home to home, potentially spreading the virus. And we certainly have seen the virus spread across cities from home to home to home. There were improvements where there was significant improvement in the first wave, but followed by lost ground because of the failure to plan over the summer. And the failure to plan testing, labs, and contact tracing capacity in the summer for when the schools reopened has been a fatal failure. Again, I've chosen my words carefully. It has caused death, and it continues to, because as testing got backlogged, homes had to wait for test results. They did also fail to cohort residents that were developing symptoms, but nonetheless, they also had to wait for the asymptomatic test results for days, leaving residents beside each other, infecting each other, and wandering through the homes and so on, infecting each other. It took a long time for staff to get results while they were still working. So the failure and the backlogs in testing are still very severe today. The province is no longer reporting what the full backlog is in testing each day as it did in the first wave. So it's less transparent, but there's still very significant backlogs in testing. And city after city, now overwhelmed with COVID cases, are canceling contact tracing, which is a disaster. Toronto did it at the beginning of October. Windsor just did it yesterday or the day before, as they get overwhelmed and are unable to do it. The second fatal failure has been the failure to address the management quality in the homes. There is severe problem with negligent and incompetent management in a number of the homes. That should not take away from the very excellent homes. But we've seen, more than 100 homes with major, major problems through the pandemic. And yet there has been no accountability. There is no clear infection team in each home. There is no clear infection lead who is accountable. The management have not been held accountable for providing safe and adequate care. Where PPE is not provided, where they're not engaging in infection control, where they let the staffing levels collapse and don't do anything about it, management is not held accountable. They're not replaced. And it's very serious. By the beginning of December, and we have charts in the report that show there are only 4 management orders in the second wave in long-term care by December the 3rd. There are only a handful of other management agreements, which are contracts, almost all of them are secret, and in which the home itself negotiates a contract. It can be facilitated by the ministry with a hospital or another entity to provide support. So it's not clear what the conditions of those are, but the management orders, which should be the management is taken over by a public hospital or another entity to ensure that the care is provided, are being used only very, very rarely, only after scores of residents and staff are infected and people start dying, and when it's almost too late to really contain the outbreaks in those homes. There have been no fines levied, none. There have been no licenses revoked. The ministry is sitting on powers that they have to levy fines against the homes that were passed in legislation in 2017. They're waiting proclamation. That's in the power of the Ford government to do. They have not proclaimed them. They have not levied a single fine. They have not taken a single license. There is no accountability, no real accountability for the homes that fail to provide the basics of life and the basics of safety. That is a huge, huge failing. And the third is the staffing. As Amit described, and as I've described, the staffing is crumbling in the homes. We had an opportunity in the summer, like Quebec did, where they recruited 10,000 staff. They trained them and they deployed them into the homes this fall. They did a fast track 3-month training, and they're in the homes now in preparation for the second wave. Nothing has happened in Ontario. There are piecemeal, ad hoc, minuscule efforts and as we're losing staff every single day in the homes. So in the report, we go through the gamut of directives, guidance, and policies that the government has set up. And the bottom line is they're failing. They're inadequate. They're gaping loopholes. There's no accountability. There's no substantive movement on the staffing issue. And it is causing undescribable harm and suffering in the long-term care homes. And so we'll open it up for questions now from the media. So if media have questions, could you put in the chat just the name of your outlet, and Sala will call on you. You don't have to put your question, just the name of your outlet.
There's a question from CHC News.
CHCH?
Yeah, CHCH News. You can now unmute yourself.
Hello, can you hear me?
Yes.
Hi, my question is about Grace Villa in Hamilton. You mentioned it earlier on in your talk today. It's become the site of Hamilton's deadliest outbreak so far. And just yesterday, the province said that public health as well as Hamilton Health Sciences will now be taking over the home for 90 days. This comes after 2 weeks of the union, staff, family members begging for help at this home that is in dire condition. Do you feel as though the province is acting too late on this, and should they be taking more drastic measures sooner when outbreaks are less severe?
Yeah, I watched Monique Taylor, the local MPP, almost in tears, watching the dead be taken out of the home 2 days ago, and beseeching the province to intervene and get a management order and get some help into that home. This is unbelievable. How can they defend not moving more quickly to intervene? You know, Amit actually told me last spring, you know, if there was a plane crash, in Hamilton, no matter what no matter what, the emergency room would make room for those traumas. They would be taken care of. These are elderly people, but their lives matter, and they're being left in the homes without care to die and to get sick in conditions that we would not find acceptable for anybody in our society. Yes, absolutely. The intervention is unbelievably late, indefensibly late. And the province has to answer for why they have no plan 10 months into the pandemic to systematically intervene in the homes, why they have not built capacity. And, you know, going forward, every day that's lost is a day in which we risk the loss of more lives. And so at this point, they have to build the capacity now. They need to undertake a massive recruitment strategy. They need to get teams from the community or from hospitals ready and into the homes. If the hospitals are at overcapacity, which is what's happening in this wave, then if needed, they need to call in the military, but they need to get people into the homes to help, because the alternative is to leave people there to die. Amit, did you want to add into that?
Yeah, so absolutely. I think I completely agree with everything that Natalie has said. And the other thing I think that this highlights is a trend where the voices of the people on the ground, who are the family caregivers and, you know, the frontline health workers, who really know the reality of what's happening in these homes and are reporting, you know, the failures in infection control and basic care needs for vulnerable seniors who can't speak for themselves, are instead being ignored. And then we're hearing these sort of statements, you know, these corporate type of statements from the home saying we're doing all we can, when the reality, you know, later turns out to be something completely different. So really, government and public health has to listen to the frontline health workers and family caregivers first, and have a very low threshold for intervention.
Thank you.
And just to add, if I could just have a follow-up question, just a couple of days ago, the Ministry of Long-Term Care told me specifically about Grace Villa that the home seemed to be getting things under control. And we've shared this story over and over again about the atrocities happening in that home. And now they're saying, okay, we'll send in public health and Hamilton Health Sciences for 90 days to take over. Is there a disconnect, do you think? And perhaps the doctor just spoke about this disconnect with the people who are actually living these scenarios and are on the ground every day.
Yes. So we found in the case studies and through all of our research in the report, and it's throughout, that it appears that public health authorities and the ministry are relying on accounts from the homes administrators themselves about what conditions are in the homes. And Dr. Arya just spoke to this. They need to be in the homes. There need to be inspectors in the homes. The cancellation of the comprehensive, the RQI inspections is incredibly dangerous. And we knew that dating back to the 1990s, the same thing happened when they canceled the inspections back then, and that in 1999, and so we know this. And the bottom line is that if they're relying on the accounts of the administrators, what we're seeing from the for-profit homes is a bunch of statements saying in every case that they have things under control. In some cases, they've said they're overstaffed, at the same time as the staff on the floor are reporting that half of the staff are not showing up to work, either because they're sick from COVID or because they're afraid to come in the outbreak and they have family members who are compromised, or because they've left. And so they're working in the situation in which residents are sick with COVID and more every day, and they have half the staffing, which was inadequate in the first place. So absolutely, there is a huge disconnect between what the province is hearing and what is actually happening on the ground. And there's no excuse for it. There's none. There are inspectors, public health locally, centrally has the ability to go in and see what's going on, and they have to do that. The ministry has inspectors who can go in and see what's going on and talk with the residents, talk with the families, talk with the staff. It's not happening in many of the homes, and this is where we're seeing really huge abrogations of their requirements for PPE and for infection control, for cohorting, for the very basics that would keep people alive and protect them from the spread of COVID-19, and then also the crumbling of the staffing levels.
So the next question comes in from Sherina Harris of the HuffPos. Sherina, you can unmute yourself now.
Hi, thanks so much for taking my question. So the report states that it's unclear why management orders have not been made on more homes. So I'm just wondering kind of if you had to guess what factors could be behind this, and whether you would say hospital capacity in the second wave has been a barrier to having more of these management orders.
So I'll turn it over to Amit in just 1 minute. In the first, the truth is that through both the first wave and the second wave, there are just a handful of management orders, despite the fact that there are dozens and dozens and dozens of homes in large outbreaks. And we list on table 5 in the report, you can just scroll through it. You can see, there's just masses, scores of homes with large outbreaks with no interventions at all. And so even when there was hospital capacity, they weren't making management orders. And now people need to be careful, because the ministry and spokespeople keep announcing that they're having management takeovers of homes, when in fact, in most of the cases, they're management agreements, they're contracts between the existing home operator and a hospital to come in. And so they're at the control of the existing, sometimes incompetent and negligent home operators. They're secret. They're not posted anywhere. They're not posted on the website, which normally, the inspections report website, which normally would have such orders. They're not up there. So you can't see what's in them. But in a number of them, they're clearly inadequate, because the numbers have, doubled or tripled or more after the management agreement was put in place. So who even knows what they involve? But for the management orders, which is when the management is deemed incompetent and a hospital comes in to take over the home, there are only a handful of those actual management orders. In the second wave, definitely there is a hospital capacity issue, but the hospitals are doing it anyway. The hospitals, even though they have been heroes in this, I can't even speak highly enough about what they have done. And they have kept us from sinking through this. But even where they're overstretched, where their staff have been stretched beyond, human capacity, they are still helping out with teams. The problem is that they don't have much capacity to do that. And there was no plan in the summer made to build that capacity. Really, we should have had a whole, like, all hands on deck approach. They should have brought back those retired nurses that were offering to come in and help. They should have created teams from them. They should have massively recruited. They should have had a plan for how to provide. And at this point, if we don't have the people, why is the military not being called back in again at this point? Because we're at the point where we were in the first wave when the military was called in. And Amit, I don't know if you have anything to add.
Yeah, I mean, I totally agree with what you're saying, Natalie. And I think even if there's not even capacity, so, suppose you're in a situation where you don't have staffing levels to support the basic care needs of the resident. Well, first of all, that speaks to transparency for me. Also, that, why do we not have transparency from all the homes about infection control and staffing levels? But the issue, the other issue is that even if hospitals are full capacity, they could have come up with a plan in the summer to do what Windsor did, where they had a field hospital and they converted this large athletic center into this field hospital, and they had staff from the community that were ready to go. When we're talking about outside intervention, it doesn't just only have to be hospitals. There's community family physicians, nurse practitioners, paramedics, nurses, as Natalie also talked about, that would be willing to help. But those teams need to be ready to go, and once again, need to have a low threshold for intervention into these homes. And also, there needs to be a system in place where people recognize when and where the help is needed. So when we're finding out, and the cases are at over 100 cases in a home, and everybody's calling out for help and no one's listening, and finally then the response is there, it's kind of too late, right? And I can tell you from being in some of those homes, I mean, this is one thing we talked about amongst our team, is that, well, imagine if we were here 2 weeks ago, right? We would have saved lives, and we would have saved so many people from suffering.
Thank you. And just as a follow-up question, I guess more on the side of the mandatory orders, I'm wondering if you can talk a bit about what those actually look like and entail. So is that the hospital coming in and bringing in staffing supports, or what kind of, what do those involve?
Amit, do you want to talk about that? Or I don't know if you can.
Yeah, why don't you go ahead, Natalie?
Okay.
And I'll add on to your answer.
Okay. So, so as I say, the orders themselves are not posted anywhere. And we had a really hellish time tracking them, because the province had said in press conferences and so on that they're taking over homes. And then it turned out they weren't orders at all. They were these contracts, these management agreements that were negotiated. And again, we don't know the terms of those. On the orders themselves, we don't know what they are specifically, and they may be different from home to home. That's not clear. But what is clear is the hospital does take over some, at least, management functions of the home. They help with IPAC, so infection control, and staffing. I think the levels of staffing, or from what we found from the case studies, the levels of staffing that they can provide and support vary from home to home, and they also vary from time to time. So when hospitals are providing support, sometimes they don't have enough staff to provide very much in terms of staffing teams to help with the basic care and so on. And it's a lot more kind of infection control and that kind of support. So I think that it looks like, from not actually being able to see them, that there is kind of a range of what they're able to do. And there definitely there is a range of different outcomes from them. Some have been able to stymie the spread of the virus more quickly. But of course, I mean, once there's, dozens of people infected, the ability to do that, no matter who you are, I think it becomes much more difficult. I don't know if you can add anything. Sorry, Amit has been involved in these teams. They're all covered by confidentiality agreements. So he's limited on this and what he can say.
Yeah, I mean, I don't have too much to add, but I can just say that you're absolutely right. And, there's a variable response in terms of what hospitals can provide. But of course, one would expect that if we had infection control managers, for example, in each of these homes, and we did it in the summer like Quebec did, I mean, the outcome would have been likely very different, right? Because there would have been oversight and accountability for some basics of infection control. There would have been enough PPE on site. There would have been training for staff to make sure that they're donning and doffing the PPE well. And they needed that liaison and that connection and that transparency, but unfortunately, as we're saying, it's not there.
And if you don't mind, I promise not to go on, but in Quebec, I just want to hold this out as an example because, when we look at what our government hasn't done, and it's massive what it hasn't done, and most of what it has done is in line with the desires of the homes, which are the majority for profit and which have very close ties with the government. And so when we see big loopholes and where the money is going and what the priorities have been over the last number of months, the priority for the government has been to pass a piece of legislation that privatized home care significantly and pass another piece of legislation that indemnified long-term care companies from liability for negligence. And yet did not create the teams, did not create the capacity, neither in contact tracing and testing in labs, nor in the staffing, nor in the emergency response in the homes that go into outbreak. Just did not happen at all. Like, what kind of priorities are those? How could this be allowed to happen? And then in Quebec, by comparison, the government recruited and hired 10,000 PSWs, trained them, deployed them into the homes. And then in late August, they hired, there's 400 homes there, managers for each home, 400 homes, paired them with infection control specialists and made them accountable for enforcing the provincial directives in each of the homes. Compare Ontario's response to that. It is night and day. Sorry to rant.
The next question comes from Maria Iqbal of the Hamilton Spectator. Maria, you can unmute yourself now.
Hi, thanks. I was wondering, so one of the things that we've been hearing about the homes in Hamilton, some of the homes, is that despite having the support of local hospitals, they are dealing with such a staffing shortage that they're recruiting members of the public to help them with non-medical tasks such as cleaning. So I wanted to ask what you thought about that.
Amit?
Well, it speaks to how, we needed to be much more proactive in the situation rather than reactive. And we had months to, respond to the situation in the summer. This is not new now. We're 9 or 10 months into the COVID-19 pandemic, and we knew that coronaviruses are seasonal. We knew that, we were going to have a second wave for sure. So, there needed to be a massive recruitment strategy that should have happened, really at the end of the first wave. And, to sort of add to some of Natalie's comments about how Quebec hired PSWs, that happened right at the end of May, right? And the start of June. And here we are sort of in December now without any type of comprehensive strategy to hire staff and a plan. I do suppose in emergency situations, you need to have people in these homes who can actually provide, some of these care needs. But in the long run, we really need to have, a skilled workforce, whether it comes down to PSWs, nurses, nurse practitioners, or physicians. Everyone needs to have the specialized skills that are needed to look after these long-term care residents. And that really comes down to geriatrics and palliative care.
I think the other piece of this is just the question of the danger. The cleaning staff are really very much potentially exposed to the virus, especially in homes with outbreaks. They need proper training. They can be potential spreaders as well. So, these are not sort of throwaway jobs. They are serious jobs that protect people's lives. And obviously in total crisis, they need to get people in. This is red flags go up when you have completely untrained people going into the homes in a hurry. What we're hearing in a number of the homes is that there are agency staff going in, they're not even oriented. They have no idea where the PPE is. They don't know who to ask for it. They have no training. Some of them, the government, instead of recruiting staff, has actually deregulated the staffing levels. So they're allowed to replace PSWs with completely untrained staff. And that is happening. It's dangerous. It's extremely dangerous. So yes, very worrisome. But I mean, you got to understand that it's a complete emergency at this point, and someone's got to, they need people to clean. So it is a terrible, terrible dilemma to be in.
Both. And just to follow up, so on the Grace Villa front, where the province announced yesterday voluntary management orders, so for the local hospital, but they did say it allows Hamilton Health Sciences to have operational and management oversight of Grace Villa for 90 days. So I just wanted to ask, I guess, Natalie, since you were talking about the difference between the management orders versus voluntary contracts, if you could just shed some light on that and whether you think this measure is enough.
Yeah, so there are management orders, which is an order, and it appoints a body to take over the management of the long-term care home. And then there are the voluntary management agreements, which are an array. So there's no voluntary management order. They are, like they did with the inspections, obfuscating in the use of the terminology. And we think that they have tended towards the management agreements because that's what the homes want, but it is not in the public interest. The public interest would have been served by yanking the licenses of a number of these, negligent and, homes that have just shown gross disregard for human life. I mean, there's no other way to explain it. But at this point, we don't know what's in those management agreements. And so management oversight, like all of these are very wiggly terms. Don't know what that means. We'd have to see the contract and actually see what's in it, and I don't know why they wouldn't be disclosed. I mean, thousands of people live in these homes. These are publicly funded homes. It's our money. It's, our relatives. It's Ontario citizens. They should be open and upfront about what's actually happening. And I am concerned that these are more voluntary management agreements, even in just terrible homes, than they are management orders. I don't think that those are very accountable. They give the homes a level of control that they don't deserve at this point. Not to, I mean, at this point, the goal of everyone has to be to save the most lives. It cannot be about who's friends with whom and who has which political contacts and which political leverage. The government has to operate transparently and in the public interest.
So the next question comes from Joel Wittnebel of The Pointer. Joel, please go ahead and unmute yourself.
Hey, thank you. And thank you, Natalie, for doing this. My question is a little bit more of a broader one. And I know a lot of probably what I'm going to preface my question with. I don't have to tell you, you're well aware of how a lot of the concerns that are being raised about long-term care right now extend beyond not just the course of this pandemic and not just the term of this Ford government, but well beyond. And we got a really clear picture with the military report, like you mentioned earlier this year, and we saw the public get really upset and really surprised and shocked about what those military personnel found. But when you go back and you look at inspection reports from say 5-10 years ago, there's similar concerns that were raised then as well as they were raised in that military report. And I guess my question is, how do we get the public as well as the government to pay real attention to this issue? It's been years, decades, that these same concerns have been raised with successive governments, and it continues to happen. We continue to see these tragedies play out, and I think the pandemic has really shone a light on that. But I think, the title of your report, A Call to Conscience, really ties into this sort of, I guess, a really more of a philosophical question about how do we get the public and the government to really see this for the crisis that it is and pay attention to it?
Well, I'm going to turn it to Amit in a second on this one as well. But, my sense is that the public has recoiled in horror at what they've seen. And although, I've been doing this for 20 years and 25 years. And for 25 years, we have seen really egregious negligence and terrible, terrible conditions in the homes, particularly when different governments have canceled the inspections, and then we won inspections and there were big exposés and things, got better for a while and then got worse. And over the last decade or so, more than, decade and a half, as the acuity has gone up. So as they offload more and more complex people into the homes, and the staffing has, the actual care has gone down, we have seen, growing problems, very serious problems in the homes. And, have put out repeated reports. And I tell you, there's massive public support for improving, including pouring resources into improving the homes. Look at what the Quebec government is doing. I mean, it has the full support of its population to do that. The same is in existence here. I mean, in Manitoba, with a fairly, very conservative government, the Maples home was enough to shut the province down, right? The problem is that the connections between, in our view, the connections between government and the industry are so close and so strong that we have not been able to overcome the industry lobby, which is for, end the surprise inspections, end the enforcement, no fines, right? It's passed in legislation. It passed it passed through third reading. It's sitting there as an amendment in the act with royal assent. It's waiting for proclamation, and the Ford government won't do it because they won't levy fines on the homes. And they tell reporters that they don't have the ability to do it. They absolutely do. They've chosen not to, right? This is, in our view, because there are too many connections between the industry, key personnel in the ministry, key political advisors, top people in the party, former premiers, and the industry, and it's very, very hard to overcome. The public, I think, is completely on side. I think we have failed in providing ways to make that visible, and so visible it can't be ignored. And we've been trying in the pandemic to figure out how to do that. I mean, you can't gather, but I tell you, at the end of this, there will be a reckoning, and we will make sure, hopefully we'll win some changes here with some pressure, but we will make sure, and I know that there are tens of thousands of people with us, more, hundreds of thousands of people with us, that there is a fundamental change and that there is accountability for what has happened here. But, I think people are with us. They lack a way. It's not with us, we're with them. I mean, I think people overwhelmingly are horrified and want change. They just don't have a way to do it. And those of us that are working the hardest we possibly can on this cannot overcome the connections of the for-profit industry. That's our take on it. Amit, sorry.
Yeah, I just wanted to add to that I absolutely agree. I mean, this is something which actually the vast majority of Ontarians and Canadians are supported, support a plan to redesign long-term care, and these sort of pre-existing cracks and inequities in the system have now been magnified in this horrific way during the pandemic. I mean, we've now had over 9,000 people die across the country, over 2,500 people in Ontario, and all those people actually have, or most of them would have family members who are not going to forget that this is an issue, and they're going to mobilize their friends, their neighbors, and their colleagues. There's frontline health workers who have had to once again hold down some of the most dangerous jobs during the pandemic. They weren't supported. They are still left vulnerable and sort of can't speak up, and are kind of being sacrificed on the front lines, double and triple shifting without PPE, and that's absolutely inappropriate. And these people are all going to vote one day, and these people are all going to make it an issue, and it's up to all of us to support them and rally around this issue. Once again, I don't think this is a partisan issue, because all of us have parents and grandparents, hopefully, that we're close to and we love. That's a sort of a natural human emotion, and I think everyone is really affected by this immense tragedy, and asking questions now as to how, how we've allowed this to happen now and how we've allowed this to happen for so long. So I'm really hopeful that change is going to be on the horizon.
Yeah, thank you both for that. My follow-up question is along the lines of transparency and the data that is coming out during the second wave, which I have found, the Pointer reports in Brampton and Mississauga, and we found the data in terms of long-term care that's coming from either the region or the province to be sparse and not up to date. And Natalie, if I can get you to comment on sort of the need for that, and Amit, if you could, I'm interested to know if you could put it in terms of how important that data is for someone on the front lines to know accurate case numbers, and essentially to have an accurate picture of the spread in the community where that long-term care home is.
Thank you. Well, Megan Lee, who's our staff person, who's also here, has been, from the very beginning, from like March 9th, we've been trying to track every case in long-term care among staff and among residents, and same in retirement homes and hospitals and so on. And we've been reporting as much as we can. At the beginning, public health wasn't reporting, then it improved its reporting. And then over the summer, when attention had moved away, they reduced the amount of reporting. And now we're seeing very serious changes to what they're reporting. So, in some cases, they'll give cumulative numbers from the beginning of the pandemic, so that it's very hard for people to tell what's actually happening in the second wave, which is why we're doing this. Or in some places, they're no longer giving the granular, details, the number of residents, the number of deaths in each home for each outbreak. I think it's vital, because if you imagine yourself, like we hear from hundreds and hundreds of families, they're in crisis and they're with their loved, they're not allowed in most cases when there's an outbreak. And so they need to know how many people are infected, how many people are dying. They have a situation where obviously the care needs of their family member are so serious that they weren't able to provide them at home. And they have to make a decision about whether they take that person out, if there's any way whatsoever to provide care for them at home. And knowing that it might be months and months before they can get them in, and that they're going to have to be able to keep that up. And so, people have children and they have other people who are immunocompromised in their families and so on. So these are very serious, sometimes life-threatening decisions for the families involved. They need to have the full information to know what's going on, how to make decisions. They are the decision makers often for their loved ones' care. Most of the people in the homes have dementia, and the substitute decision makers have to know what's going on. So home after home, we're hearing from families that cannot get a hold of anyone. They phone and phone and phone, they can't get through. The staffing is in crisis. So this is one of the key ways for those homes, for families to know how to make decisions. It is critical. And the other thing is that it's just an issue around transparency. In whose interest would it be to hide those numbers? I mean, really, it's certainly not in the public interest. Amit?
Yeah. And just to add to, I think, some of the things we need to have full transparency on, as I kind of mentioned, cases and deaths are not enough. We need to know about staffing levels. Like, I mean, imagine if we had a dashboard showing us about staffing levels in each of the homes, then we could sort of try to arrange for replacements early, or have other people go in from the community, whether it's nurses or PSWs. And along with staffing levels, I would like to add physician presence. We know that's really not been discussed a lot through this pandemic. And there's been some homes where I know physicians that have actually been assessing their patients daily. And then I've been in other homes where there was no physician presence for 6 weeks. And that's absolutely atrocious. I mean, had there been sort of a call out, and had this been publicly available information, we would have found physicians to step in. We need to know about advanced care planning. We need to know about infection control procedures and stocks of PPE. And that stuff should all be publicly available, so that, there can be appropriate action taken early on.
Thank you.
If anyone else has any questions, please indicate in the chat. Otherwise, those are all the questions we have for today.
Okay, good. Okay, so, oopsie.
Joel said he wants one more question. Joel,
Sure.
please go ahead.
Yeah, sorry. Thanks.
No,
I didn't know if it was just one question, one follow-up, but I appreciate it. Just one more. I think, we've done a lot of reporting on, obviously, the staffing crisis, and it's something we've seen throughout the pandemic. And I really just, in a practical sense, this recruitment strategy, is it a matter of we need to bring in bodies from out of province? Where will these staff essentially come from? Because I imagine it's not a matter of we have a big sort of reserve of PSWs just waiting in the wings to be brought in. So I'm curious where this recruitment strategy would be targeted, and how we're going to get these people to get into these roles, so that we can sort of lift up the staffing levels in these homes.
Amit?
Yeah, so I'm hearing from PSWs that we're 30% short compared to how we were before the first wave. 30% short, and that's sort of validated by our own Ontario Health Coalition staffing survey that came out in the summer. In the summer, where 95% of people once again are reporting, 95% of frontline health workers are reporting staffing shortages, and over half are reporting daily staffing shortages. So the reason that these people have left their jobs is because the working conditions are so terrible and they're not paid enough. They need to pay them like the top rate. We need pay equity between hospitals and long-term care homes. We need to make sure that we give them sick leave. We need to make sure that we give them benefits, and we need to make sure that when they're working in these dangerous conditions, when they could get COVID-19 and contract it themselves, that they're kept safe and they have support on how to use PPE properly, and they're actually protected with sort of infection control managers to make sure it's not just them but the residents that are kept safe as well. So I think that's step one, is that needs to be not just an option, but it needs to be absolutely enforced at this point in time. It cannot be something that is left up to the homes. And the reason I'll say that is because we know that a large proportion of the homes that have been affected by COVID-19 are disproportionately the private for-profit homes. And the way that these homes actually, or these corporations generate revenue is by reducing the cost of labor. So it's appalling that even at this point during the pandemic, they're maintaining their shareholder dividends. And one way that they're doing that is by not paying their health workers enough, even at this point in time. So we need to forget about those shareholders. We need to give them a massive pay cut and pour this money into staffing and improving the conditions of work, so that we can re-recruit some of those PSWs and also train and bring in new people, as Natalie mentioned.
So there are, it's not like we have to go to other provinces. Quebec recruited within the province, but they increased the wage to $26 an hour, and they paid them $21 an hour for training. So at this point, they're going to have to look at something like that in Ontario. With, in Quebec, they launched it June the 1st. The province did this. They didn't leave it up to, some, little community colleges all over the place to do whatever they could do. The province did it. They set a pay level for the training. They improved the pay, and they set out to recruit 10,000. They got 60,000 applicants. There are a lot of people out of work in Ontario right now. There are a lot of people. If the conditions could be made safer, if the pay was attractive, if the working conditions were not just crushing workloads and terrible, hard physical labor that you're doing unsafely because there's not enough staff and so on, it would be possible to recruit back existing PSWs, and it definitely would be possible to recruit more. We also need the nurses and the RNs and so on. They need to figure out how to fast track training, and that's in hospitals and in long-term care. So the picture needs to be looked at. We need a small army of staff at this point, and every day that's delayed, the situation is going to get worse. I just wanted to say one last thing too, which is that the province has tried to focus attention on the rollout of the vaccine, which is fantastic. Obviously, we are so thrilled that the vaccine is here. But the staffing crisis in long-term care, first off, it's going to take months. I think they said till March to vaccinate in long-term care. But in addition, the staffing crisis is not going to disappear while the conditions remain as they are. The work is crushing. There aren't enough staff, and staff don't even last a week when they get into the homes in those kinds of conditions. So there is no recruitment and retention, even with a vaccine. Maybe things would improve a little bit, but we're so far from being at a safe level of care that just the continued refusal to do anything means that the vaccine is not going to be the panacea to get long-term care out of the crisis that it's in. We wish it was, actually, but it isn't. And so this still has to be dealt with.
Thank you both very much.
Thank you.
Thank
Is
you.
there anything else? Okay, well, listen, you've been very patient. So thank you very, very much, everyone, for being here and for caring and reporting on this issue so much. Thank you. Bye, everybody.